Good evening, everyone. Thank you for joining us. Thank you for tuning in and welcome to another school year. Really happy to have strong participation on the webinar tonight. And I think that shows the excitement and the enthusiasm heading into a new school year. Our teachers have been hard at work on campus, with new teachers being here on Monday, Tuesday, and returning faculty joining them, and everyone working together yesterday and today, and looking forward to another day concluding this week tomorrow, all in anticipation of student arrival and working to support our students and families over the course of this year. So really happy to be back. Wanted to host this event to recap some of the announcements of policies and procedures that I made on August 12th and the communication that we sent via email, and also to have the opportunity to answer questions. You know, when you're getting a letter, it's more of a passive communication. We've over the last year and a half since COVID began in March really of 2020, but even we're communicating at the end of January 2020. But since March, I've been doing these webinars on and off, and I think they've really been a way to have some active communication, some participation among parents, a chance to answer questions. So I'll do a short presentation similar to our usual format, because we have new families with us tonight who are just coming to Cushing for the first time this year and are excited about that. I'll have some review on our approach so far. I know I've done that before, so even with new families, I've had the opportunity to do that. But we'll talk about sort of our underlying philosophy on our approach for this year, with a little bit of a review from last year and how we're continuing some of those practices to keep our community healthy and safe, and to bring our students back. And then at the end, I will have Q&A. I've asked Elise Lewis, Director of Health Services here, a nurse practitioner on campus, to join me for some question and answer. If you have questions sort of outside of the realm of arrival, COVID policies and protocols, I may direct you to those individuals on campus, but we'll certainly give you some high-level responses. And then if you have granular, individualized questions, we'll probably turf those as not to keep everybody on longer than needed. So a big welcome to our new and, of course, returning families to a new school year. And a few times during the course of the school year. And again, as the summer progressed and we've had some increases in infections, which I'll talk a little bit about due to the Delta variant, we decided that we need to really keep going, which we didn't stop anyhow, but keep going with some mitigation practices, which we had all summer here on campus with our summer program anyway, but continuing those and looking at ways to refine those practices and policies for the school year in order to have a more normalized type of experience and a more sort of robust student experience that our students all enjoy at Cushing. Just as a refresher, our Cushing medical team, as I said, Elise will join us after for question and answer. She's our Director of Health Services, Master's in Nursing and nurse practitioner. Dr. Michael Muchler, MD, is our physician, Cushing Academy Medical Director. Dr. Muchler is actually a past parent of the school and has been our medical director for over 15 years. Both were members of our key members of our task force last year, and continue to practice and advise as we head into the fall to keep our community safe. And also, similar to last year, advisory members of our medical team who are also involved in planning and giving us feedback on our plans. Dr. Christina Ermos, she's a pediatric and infectious disease physician at UMass Medical and an assistant professor there. And also Dr. Ann Hohen, and she's associate professor of epidemiology at Dartmouth Medical School. And Dr. Hohen is also on the Dartmouth task force, reviewing plans for Dartmouth's return to in-person learning both last year and this year. So happy to have them still with us this year as we continue to monitor, evolve, and develop practices both for our operations on campus, but also for the experience that your students have here at the school. We've had planning committees that we're still continuing. So our student experience committee, led by Associate Head of School Catherine Pollock really covers every part of the Student Experience Committee, partnering with Josh Doyon in Student Affairs, Raj Bala in Academic Affairs, Jennifer Viana in Athletics, Dr. Jen Willis, who's Director of Teaching and Learning, all, and then partnering with different departments as needed to look at the student experience and ways to plan for how students will interact with all the various aspects of programming at Cushing. And then campus operations and business continuity, led up by Paul Silva, our CFO, continues to focus on facilities, food service, IT, transportation, finances, human resources, all of those other aspects that support your students here at the school and our faculty and staff. And of course, focusing on health and wellness with the medical team, but also our counseling office, John Price, Director of Counseling, and then communications, events like this, letters that you saw last week. Sometimes we communicated on our emergency notification system, whatever's needed to keep families in the loop. We have a web page for fall arrival, for example. So things like that, which we continue to evaluate, look at, and think about ways that are best to communicate with our students, with our families, in order to make sure everyone's on the same page and understanding what it's going to be like coming back, at this point anyway, coming back to campus here in Ashburnham. As I typically do, review, this is Massachusetts COVID dashboard cases from today. So 1793 new cases today, which is up from the last couple of days. We were hovering at around 1,500, and then it dipped into the 13, 14 for a couple of days area. So that is a bit of an increase. Hospitalizations, 565, which is a bit of a decrease. Yesterday, we were at, I believe, 573. Before that, in the mid 570 range, so a small decrease there. So continuing to monitor not only local community transmission, state transmission, and also looking at regional transmission as well. But really what we've been doing this summer is, as we left in the spring with a really optimistic view with vaccine and cases decreasing and thinking about a plan at that point, and then sort of having to shift gears mid-July when it became clear that the Delta variant had taken hold and had really caused an increase in cases. How do we work to maintain a healthy campus and really try to bring back that normal type of student experience? And no matter how long our country is dealing with this, hopefully not for too much longer, but at the same time, we need to plan for how do we give a normal experience to our students if we are indeed in a COVID era or a longer period of time. So that's really been the question that we've been wrestling with, facing, and the outlook that we've been trying to have as we meet this academic year and look forward into the future. So how do we meet our mission while mitigating viral spread and keeping the school health and safety a priority? We do have similar priorities at the state and federal agencies. School needs to be in person, and in conjunction with that in-person experience should include every aspect of the program offered at the school. So really want to look at athletics, arts, activities. How do we make it a robust student experience where our students are taking advantage of all that Cushing has to offer, while we are mitigating the viral spread, keeping health and safety a priority. Because our goal is to continue those things, but to still have really great positive outcomes and improve that outcome each and every year, as we try to do every year. But in this case, with an additional challenge of COVID-19 and the Delta variant, we need to sort of pivot a little bit, adjust, come up with new tactics to achieve those goals and strategies. So a little bit about variants. I know it's all over the news, and we're probably hearing it from different places. So, we tend to, of course, take the advice of our medical team. COVID Act Now has been a great resource if you've ever been on that website. So just a little bit of a review, in talking with our team and looking at sources and, the things. I shared this actually with our faculty this morning, some good conversation there. But they occur, when there's a significant change or a mutation to a virus, and that's normal. It's why we get a different flu shot every year, dealing with different strains of the flu. Variants are normal and expected for those types of viruses. And the World Health Organization has, and you've probably heard this, categorized 4 variants of concern: Alpha, Beta, Gamma, and Delta. And of the 4, Delta being the most contagious, Last year at the beginning of the pandemic, we talked about, if you remember, a couple of times, especially members of our medical team, Dr. Hohen in particular spoke about this, the R naught number. You see it in writing. Sometimes it's an R with a zero or a little zero. And that really sort of in, I think, layperson terms, shows how each person infected with COVID, how many people they would infect in turn. And initially with COVID, that number was estimated to be at 2 or 3. And the CDC is now estimating that the Delta variant is between 5 and 9. And I think that's manifesting itself right in the country today, where it's much more contagious. And that's for unvaccinated individuals, that estimation. So as I said, because of that, we're seeing a surge in cases this summer, and we need to make some adjustments. There is evidence that Delta variant may cause more breakthrough infections than previous strains, and I know there's news all over the map about this, and there's so many variables about how effective each individual vaccine is against Delta variant infection. Wanted to share a couple of resources sort of on both ends of the spectrum and encourage you to do your own investigation. Again, the first is from the New England Journal of Medicine, a study showing the Pfizer vaccine is 88% effective at preventing infection from the Delta variant. But again, one study. Until that's repeated many times over, I think that's promising news and certainly optimistic, but probably also a first glance at that piece of information. And then sort of on the other end of the spectrum, real world data from Israel. This was an article in the New York Times, was more around 39%, but that was longer period of time since the initial infection. And there were some conversations, criticisms on this article about smaller sample size, a lot more variables. So we don't really know, but we certainly do know that it is more effective than the other choice, which is not to be vaccinated. So Pfizer, at least in this case, shows some real promising effectiveness rates against the Delta variant. Another piece of information I thought I'd share from the Global Health Network is that full Pfizer vaccination is 96% effective against preventing hospitalizations from the Delta variant. And unvaccinated people make up more than 95% of COVID patients in American hospital bed. And that's from the Global Health Network. And I know our local hospital, Haywood Hospital, releases public stats on this every day. The CEO does messages. You can see that by going to YouTube or subscribing to their channel. And certainly in their most recent message, they have 9 COVID patients, 8 unvaccinated. So that trend that you see from the Global Health Network is manifesting itself even locally as well. So taking all of that and thinking about how we want to philosophically have an experience for kids that's robust and positive, and balancing it with the need to have a safe and healthy community and mitigate viral spread, we do have new policies and protocols and also federal agencies and adjust as needed and as appropriate. As I did mention, we sent that initial communication about protocols on August 12th, which I will review tonight. Not too many, actually, not really any changes, maybe some clarifications. We do have our fall arrival page on the website, which I know you've seen letters from me, from Catherine Pollack, from admissions, highlighting arrival and when students would need to sign up and how they get here and all the other information that kind of goes with that. Please find it on our fall information page for you to take a look at and contact admissions if you do have additional questions there. As I said, still looking at federal, state, and local guidance, even though sometimes there may be conflicting recommendations and guidance or advice that may apply more to public school type setting and others to congregate living types of situations. So we're going to take all of that and come up with the best solution that we think fits the needs for Cushing Academy. Few things on arrival day. So as you've seen, communicated and hopefully responded to at this point, but if you have not, please, this would be kind of the 11th hour to sign up for an arrival time. So please do that if you have not. We're doing that to de-densify arrival, to organize it, prior to sort of pre-pandemic normal was just arrive between, this time and this time, and there would be ebbs and flows and peaks and valleys of traffic. We're trying to really control and know who's coming at one time to create a steady flow and de-densify as much as possible on arrival. We're requiring everyone to wear face masks, coverings indoors that day and every day, at least for the first 2 weeks, which I'll talk about a little bit later, but no exceptions there. Need those face coverings on at all times. And we're limiting 2 guests or visitors per student, again, to de-densify campus. We have, a full slate of students coming, and that can be multiplied pretty quickly with guests and visitors. So I want to try to keep that under control, both with arrival times and controlling who's coming when, but also the number of people during that time. We are requiring proof of PCR tests 72 hours prior to arrival, regardless of vaccination status, due to what I was just talking about with the Delta variant and the rise of infections that we're seeing in the country, and also proof of vaccination. And we do allow exemptions as allowed by law, but would like to see that proof from all coming to campus as well. Cushing students additionally will receive a PCR test similar to last year upon arrival, but we will not have a campus pause. And if you're new to Cushing, last year when we would onboard students, there was a test on arrival and then a pause where all students would be in their dormitory as we waited for results. And that was the philosophy behind that, was to prevent a lot of contacts with individuals that we didn't have test results from. And then if there were some positives, we could remove those individuals from the community until they were allowed to come back, and there wouldn't be an exponential increase in the number of those that would have to leave to come back. However, we feel pretty good at the advice for our medical team with everyone wearing masks indoors. And then with our own vaccination rate and requirement, which I'll talk a little bit about in a few slides, that we can resume our normal sort of activities immediately, such as orientation and preseason. So facial coverings, masks, one of our main mitigation practices, those will always be required indoors, except while actively eating and while in dorm room with roommate, regardless of vaccination status. So that means walking into the dining hall, it's on, getting your food, it's on, sitting down, it's on, and then take it off and eat as we normally would in the cafeteria prior to COVID. So if you have to get up, put it on. And again, one of our main mitigation strategies that we'll need to do, at least for the first 2 weeks, maybe longer, the Department of Elementary and Secondary Education in Massachusetts, at the urging of Commissioner Jeff Riley, approved his recommendation Tuesday for all public schools in Massachusetts to remain masked until October 1st. Now, that ruling does not apply to independent schools such as Cushing Academy, but it is one of those state agencies that I spoke about earlier that we do monitor for guidance, advice, run by our own team, our own leadership, and come up with what's best for us. So it is an area that we're looking at. We're going to stick with the first 2 weeks, maybe longer, depending on how community transmission goes, how our results of testing go here. It could be longer than 2 weeks, could be 3 or 4, could be till October 1st. I really don't want to guess at this time. I really would like to have a pretty much normal experience here on campus with students wearing masks indoors at all times, be able to stabilize that hopefully, and then make decisions about where we go forward from there. We are not requiring, sort of the opposite. We are requiring them indoors. We're not requiring them outdoors. That includes athletics. So if you do play an indoor sport in the fall, mask will be required. If you play an outdoor sport in the fall, it will not be required. At least for the first 2 weeks, and we will go from there. As I said, with everything with COVID, it's ever changing. It's shifts in a lot of different directions. Guidance will come, it'll be conflicting, and so we have to adjust as appropriate for the school. We've taken a slow, measured, thoughtful response throughout the pandemic. We will continue that. And I think that reflects what we do really well, which is to serve students in the best way possible, provide that robust experience, and to maintain the health and safety of our community. COVID safety checks, which are our surveillance tests. So last year, after our initial arrival test, which I just spoke about, which we're going to do this year, we did do weekly surveillance testing, which we're going to continue at least for the first couple of weeks. So we will do that weekly COVID safety check or surveillance test for all members of the community, regardless of vaccination status, for the first 2 weeks. Again, really want to ensure that baseline, want to make sure there's not a late positive, the period at which if someone contacts it right before they come to when it would manifest itself on a test or with symptoms could be as long as 2 weeks. So we want to be sure that we're establishing a baseline right away, and then may or may not require surveillance testing for various groups as we continue. Weekly PCR tests will continue for unvaccinated individuals indefinitely, and those will have to be paid for by the individual families who need those weekly PCR tests. And if they need rapids or anything else, as I get to below, those will need to be paid for out of pocket as well. Symptomatic and unvaccinated. So if someone does have symptoms and they're unvaccinated, they will be required to have a rapid and PCR test along with likely isolation and quarantine while we wait for results. Although rapid would happen immediately, so you'd know right there, but we could say the rapid's negative, you're having symptoms, we want to wait for the PCR. It is possible that you would be isolated until we'd have that result. So we really want to be cautious, particularly with the high R naught of the Delta variant. And if we know somebody's unvaccinated, that will definitely err on the side of caution. Symptomatic and vaccinated, we will do a rapid test. PCR may be required depending on a number of variables that are present in each individual case, which we will look at, review, speak with our health services and medical team, which will make a recommendation, and I'll decide from there. But again, maintaining the health and safety of our community, so we'll take a cautious approach. Quarantine and isolation. So we do have a full campus this year. We do not have the 100+ students who are doing remote learning, which we don't plan to offer this year. So because everyone's here, we do have limited space for quarantine and isolation. And in the communication I sent, it is important that domestic students do have a plan, and we're collecting that information to be off campus for 24 hours if they are COVID positive. And international students, similarly, having that local guardian or plan to be off campus in 48 hours. The reason for that is if we have limited space for quarantine and isolation, and if there are a series of infections, we need to be able to have quarantine and isolation space, clear that out, clean it in order for the next person to come in. Knock on wood, hopefully we don't need it, but we need to be able to sort of hope for the best, plan for the worst type of situation. So that's really important. And please make sure if you haven't filled out that form, you get that in. One difference when we talk about contact tracing and quarantine and isolation, the CDC does not recommend quarantine isolation for vaccinated individuals who are deemed close contacts of a COVID positive individual. We hopefully will go in that direction depending on the individual circumstance again, but that is possible that if you are a close contact and vaccinated, that you may have sort of a hybrid approach where you'd have additional monitoring and testing, or a rapid test and then a PCR and then surveillance testing. I think each case will be different, so we want to sort of leave room for ourselves to have some flexibility in that decision making and approach to each individual case that may present. But just something to be aware of, that there is some additional freedom there for someone who is vaccinated that does end up being a close contact. We may or may not require quarantine and isolation of contact. Where to go from there. Visitors home visits. So last year, we did not allow visitors to campus or home visits. So I think a lot of families will be happy to know that parents and families may visit campus and attend games. We are going to ask all visitors to remain masked while indoors. And then students leaving for the weekends can do so per normal Cushing policy. So we do have some weekends, community weekends, and things like that on the calendar where we don't allow students to leave campus. But we do ask when students do leave that their families and those students as individuals themselves practice viral mitigation strategies while off campus in order to maintain the health and safety of our community when they return. Dining services will resume normally. Students will no longer eat in cohorts. So if you remember Waddles, our students were eating in each individual group and several feet apart. Dining hall was at very limited capacity. Again, with all of our students back, we need to have all of that space in the dining hall, so it will be at full capacity. Again, as I said earlier, when talking about masks, students will be required to wear those masks except when actively eating or drinking. Again, masks, one of our strongest mitigation strategies. We want to start off with a really sound footing and be able to establish a baseline, hopefully, of all negative results. So we really ask that those masks remain on except when actively eating or drinking, or in your own room with your own roommate and the door closed. So stress that enough. I think, in order for us to maintain all of the other experiences, this is going to be a important point to stress throughout the year. We will not allow guests or visitors in the dining commons until further notice. And again, that's just one, to densify the space, and two, just to maintain that's a place of risk where masks are off, and we want to control it as much as possible. Athletics. So we are planning on a full year of athletic competition. Masks will be required at this time for indoor practices and competitions for at least the first 2 weeks. And then after that, they may be required for unvaccinated, but meant to come off for vaccinated. And as I said before, it could be 2 weeks, could be 4 weeks. We really don't know. But hopefully we can, our goal is to, if we can, get back to normal as soon as possible, but also want to maintain that robust experience. So we'll do so carefully. Students and employees will be required to mask on buses and vans, again, traveling to and from athletic events. That's another place where, masks should be maintained in a close area together. So that's important as well. And then guidance is evolving and will be revisited as needed. I know that happened last year. One of the things that happened today that we're still chasing down is some of our opponents are coming out saying they will not play a team that is not 100% vaccinated. So that would mean, even if 99% and there's one student, they're saying, that school will not play us, even if we don't have that student play. So that's something we're chasing down, seeing how many schools are taking that tack. And I will update as I have that information, but just something to keep in mind if you're an athlete and unvaccinated. Lastly, just a few things, the day-to-day experience and operations, some questions ahead of time about common areas, common rooms, student center, et cetera. Those indeed will be open. The indoor spaces obviously will require masks, as I said before. We're not going to have indoor assembly or community lunch for at least the first couple of weeks. Those big, large community gatherings where we're all in the same place at the same time, I think that's something sort of we can eliminate right off the bat, and maybe we'll introduce it back slowly, where maybe we do the assembly first, see how that goes, and then, keep the masks on, but community lunch is where they would be off. So that might be the sort of something later to come. We are planning on convocation to be outdoors. So hopefully we have some nice weather there. We do and will continue to do the OXAP. However, we will not do the daily temp check. So that's something that might be a little easier for our students. Still have to fill it out. It's still a screening for symptoms, and it enables us to collect some good data. And it's important that we get that done every day. But no daily temp check there. But rather a screening through the OXAP. We will allow visits to town as permitted prior to COVID. We really see the town of Ashburnham as part of our campus. It's adjacent to the property of the school. Students will be required to wear masks indoors. Flu vaccine will be required, similar to last year. And then for our day students, we actually had a day student barbecue a couple of days ago, and wanted to announce that the day student room will be open, and that day students may participate fully in activities and campus life. And we will continue to assess all of these policies, as I said, about masks and other things, due to a variety of factors and variables as we progress through the fall and through the remainder of this pandemic. When we began this process of bringing the Penguins home in fall of 2020, our strategy was really based on 4 areas of prevention: mitigation, testing, screening, and contact tracing. And I thought it was important that even though we're striving for a more normalized experience, that we still do have this 4-pronged approach to maintaining a healthy campus. There are some mitigation strategies that were no longer practicing, such as dedensifying the dining hall. And last year, we had some students remote and some on campus, and there were you know lots of areas of social distancing and couldn't go into town, things like that. But we have added, the vaccine requirement as a mitigation strategy. We're remaining the masks, at least for now, as a mitigation strategy. So that is still an area where we see strong representation. Testing was the second, and we still are continuing that. So you all had to do the PCR prior to arrival. Students do it on arrival. And then, at least to begin, weekly surveillance testing, but we will still utilize testing in some format, even if it is not community-wide surveillance testing. It'll, likely be those who are unvaccinated, and then as I said, if there's somebody symptomatic and they are vaccinated, maybe that surveillance testing increases at the recommendation of our health professionals, but testing will still be a part of our protocol as we go through this COVID era. Screening, although, the temp check isn't there, we still are gathering that data on a daily basis from all members of our community. So we will still have the OXAP as a screening tool for our students. And then contact tracing, if there is an event where we do need to investigate close contacts, that will be a strategy that we employ as well. And I think when we, again, to revisit something we spoke about at the beginning of the pandemic, I think we have several advantages at Cushing, and many of those remain, and there are others in addition. We did have a really successful remote hybrid learning experience last year, and lessons learned from that. And one of those was that we're all committed, families, faculty, students, staff, to that in-person, robust, positive student experience, which leads us to one of the foundational aspects of the philosophy for coming into this year. We do have expansive and new facilities, state-of-the-art dining facility, 2 gyms, our rinks, several new dormitories, so a lot of space to be able to move around, even with a full campus. I think we are fortunate in that we do have a number of areas that we can utilize throughout the course of the fall, and also some beautiful outdoor space with the construction gone, especially in the campus green. Lots of opportunity for hanging out. We had some beautiful weather this week, and actually last fall as well, really right into November. So hopefully we can get lucky again this year in terms of being able to utilize outdoor spaces and get through the fall as well. Once everybody's here, we are a pretty isolated campus in a rural location. That going into town is really, a short 2-minute walk and only, a few options there, but really isolated here in Ashburnham from, hotspot type areas. And even in Massachusetts and the region, we have a high vaccination rate, both in the state and on campus. And I will release next week, probably middle of the week, maybe late in the week, our vaccination rate. It is extremely high. I'll give percentages, and if that changes, we'll communicate that. But also feeling really good about that as an advantage of Cushing Academy. Do have a small class size, so in terms of being around a large number of students, I think that's controlled in the individual classes that you go into, where it's a reasonable amount of students per room. We are 90% plus boarding. We're actually 92% boarding. And of our 30-day students, 15 of those are children of faculty. So it is a real true residential community. And that's the highest percentage boarding school of any independent boarding school in Massachusetts. So it is a real niche and a unique aspect of the program that we offer here, a true boarding community among our students, among our faculty who live on campus. So that is a community that is here and not going home or somewhere else, every day. So I think another advantage. Strong enrollment, and our families are excited to return, both new and action among our competitor school. Had a great record last year. We're able to stay in school, which was the most important thing. At the beginning, we talked about it wasn't only about opening, but staying open. And this year are adjusting again in that, as I spoke about, thoughtful, measured approach that's best for everyone on campus. And it did reflect really well in our outcomes. So happy about that, and really do see that as an advantage as well, as students are coming into the school, whether it's the first year or the fourth year, to experience everything that Cushing has to offer. Lastly, I'll often give a timeline on these webinars if this is your first. Lots happening usually it's several weeks out, but we have a lot happening at the beginning of school, and certainly campus is buzzing with that energy that only the end of August and September can bring. August 26th, which is today, doing this webinar to kick off the fall and the school year. Our proctors arrive August 30th, and then September 1st, we have preseason athletes and new international student arrival. And then Saturday, September 4th, the remaining students arrive, and we get ready to go on class for Monday and convocation and to begin the year together. So coming home again, opening isn't going to be an event, it's a process, and it continues to be a process and an evolving one. And I thank you for being a part of our community, for your flexibility, for your understanding, and for your excitement as we approach this school year with some optimism, hope, and energy for a much more sort of pre-pandemic, normal-like type of experience. So hopefully we can maintain that, but ready to adjust if we can. So I'd like to ask Elise to join us on here. I see there's a few questions in the question and answer box, so I'll get right to those. We'll do our best at answering. As I said, if they get too granular or specific to your experience, I'd definitely refer you to the appropriate office or even set up that introduction so to make sure that your questions get answered. But let me take a look at the questions. All right, first question right off the bat. With the requirements made very clear, why are we allowing unvaccinated students on campus? Currently, we are following Massachusetts law, which does allow for exemptions to this policy. That's the decision we've made as a leadership team. That's also the advice that we have and what we think is right. As I said, I will communicate what our percentages of the community are. It's going to be quite high, but we'll get that out as soon as possible. And we'll continue to urge unvaccinated individuals to know that that's the best protection against serious impacts from COVID. Percentages we will give out later. Confused about comments and policies regarding unvaccinated, including about 100% vaccinated sports teams. You announced vaccines were required in the spring. Is the entire student not vaccinated? Why not? As I said, Massachusetts law allows for unvaccinated students and exemptions for medical and religious reasons. I anticipate and project that it will be a small number, but we do have to allow that by Massachusetts law. Even with full FDA approval, that still is a requirement. Will it be possible for parents to assist students in unpacking on arrival day? So as we reviewed, we are allowing 2 visitors and guests per student to help them. Yes, they can help arrive and even unpack, but we do have specific requirements about PCR testing and vaccine. And if you are going to try to submit an exemption, we do have a form that has to happen. Our admissions office can help you with that. Will students be, so 2-part question. Will students be allowed to go into Boston? So at the beginning, we're going to try sort of to start small and then spread out with activities, depending on what's happening public health wise. So certainly if there are weekend home visits, we are allowing that. But in terms of organized student activities, we're going to sort of dip our toe in the water and then move slowly from there. And then the second part of that question, must visitors after move-in day be vaccinated to enter? So yes, same requirement will be required for visitors coming to campus. Again, you can visit campus if masks are maintained indoors, but we would like parents to show proof of vaccination when visiting. Will they meet so yes, students will meet their roommates on arrival day. Elise, do you want to talk about the next question? If there are contagions, and did the health facilities have the capability to handle severe cases? And I think that's what that person's getting at.
Sure. So yeah, so we have capabilities of handling a wide variety of things, but if a student becomes unstable in any way, and I'm thinking about oxygenation level, their ability to breathe, it is best that they're served in the ER. We have partnered with UMass hospital system as well as Haywood. We have great relationships with both, as well as Ashburnham EMS in case of any emergent situation where a student becomes unstable.
Great, thank you. Next question, on arrival date after registration, parents have to leave. Yes, and that's actually normal policy. Usually, during registration day, there's a time on the schedule when parents say goodbye. So, it's usually a few hours on campus. We ask that sort of get students settled. Usually there's a quick parent meeting and then parents depart. Do parents need PCR tests if they plan to stay and help unpack? So again, all parents coming to registration day do need that PCR test 72 hours prior.
As well as proof of vaccination.
Exactly. And if not a proof of vaccination, then an exemption filed. So next question's about school travel during long weekends. I think a few weeks at least until long weekends. Don't have any plans at this point. I think it'll depend on a lot of different factors on if and what type of activities we're able to offer during that time. We do offer usually a wider slate of activities during long weekends. Travel, I think, is TBD. If you refer to the schedule for helping to unpack, there is a timeline there with meetings. It depends on your arrival time, on how long that you're allowed to set up. So I'd encourage you to go to the arrival page and you can see the full schedule there for parent arrival, different commitments during that day. Elise, do you want to take this one? Considering vaccinated people are also getting COVID, why are only unvaccinated students getting weekly PCR tests? I think there's a misunderstanding there. And how much will this cost the family?
Correct. So our vaccinated students will be getting COVID tests for the first 2 weeks. Actually, our entire student body and employee body will, regardless of vaccination status. We know that transmission cycles last about 2 weeks. We're asking families to risk mitigate when they do go home after that time period. PCR testing varies. It really does. Most of them trend around about $150. Some of them are cheaper, around $55. It really depends on the supply that we're given. And then we'll be able to better answer that question.
Great. Thank you. Class schedules are beginning to be populated in my Cushing, so you should be receiving those probably next week at some point on registration. There is an add drop period, so there's plenty of time to make sure that is the right schedule for your individual student. On registration day, the next couple of questions about directly to their dorm and which dorm they live in, all of that's answered on registration. Still working on the final details there, but on registration day, you will get that information. Yeah, activities on the first day would be meet advisor, meet and greet, parent meeting, I'll meet parents, those types of things, absolutely. Again, similar type question, do we need to set up an appointment to help our students set up their room? Yeah, please refer to the letters that you've seen from the admissions office, which talk about signing up for a time to arrive on campus. And then from there, if you meet sort of all the requirements and the student gets PCR tested, one of those
So you'll still be getting some notifications. I'm sure you've heard it from my team. I think this particular question is indicating about an off-scheduled arrival because it says the 31st. You should really be contacting Josh Doyon in Student Affairs at studentaffairs@cushing.org. Me and him work together as a team to make sure that that's something we can accommodate.
Thank you. Question about, does a student keep an advisor, same advisor for 4 years? Oftentimes a student does. Sometimes if a student would like a change, we'll try to honor that request. So it really is up to the individual, but oftentimes that advisees stay together until graduation, but not mandatory. Question about the all-school handshake. So we're working on a revised event. So some type of a hybrid. So last year we didn't do anything. This year we are going to do some form of that. Probably won't involve a handshake, but still will hopefully get the same result that the all-school handshake does. So stay tuned. Students can, per normal Cushing policy, when students are allowed to leave campus, whether international or domestic, can leave during the weekend. And we ask for, again, students to practice mitigation strategies when they are. Question about international students and who they, and American students. And, we often encourage students to, room with individuals, anybody on the campus, and international, domestic, wherever they're from. So certainly we do have cases where international students are living with domestic, where international with international, domestic with domestic. There's all sorts of different combinations. So I'm not quite sure what you're getting at with that question, but that's still the case. Students go back home on the weekend. Do they need PCR testing to go back to campus? So they do not. At least we still would maybe require surveillance testing. Right at the beginning, we do have weekly surveillance testing, so that would capture everyone, and then we'll determine how we want to proceed after that. Do you want to add anything?
No, just make sure that you're very familiar with the CDC guidances for travels for vaccinated and unvaccinated individuals. Those are some standards that we've been holding on campus, so just be familiar with those. If you need that link, please let me know.
Thank you. I think this question's about how safe is the surrounding town. I would say it's very safe. We haven't had any incidences during my time here. Certainly, my children have gone into town oftentimes, and a number of other returning students have gone into town. I would say when you're on campus, you could even chat with some of our returning families, and they could talk about that as well. But I would say it's very safe. Can I change my arrival time? I would say after this evening, contact the admissions office and they can try to see what we have left. I know those are filling up, so it may be possible, but I'm not sure what's available and what's not on each specific day. Elise, maybe you can take this one. Can you clarify the 72-hour PCR test frame? Currently, our state's taking longer than 72 hours.
Yeah, a lot of states are having that issue, especially the states that are having surges with Delta. As far as the students go, if a student has a PCR test pending, I would just need confirmation that there was an appointment. And I would do a rapid test on them upon arrival to campus pending that PCR result, and still ask that you update that to Magnus. Unfortunately, based on state laws and our community rules, I cannot do rapid testing on non-students. So we're going to have to work on that on just a case-by-case basis and hope for the best. I understand that there's a lot of resources being sent to those areas with high volume. So we will keep our fingers crossed that everything works out.
Thank you. Will vaccinated parents be allowed back on campus? Yes, absolutely. We are scheduled to be PCR tested on September 2nd at Leominster. At least, do you have some experience on that?
I just had one done in Winchendon. Most of mine have been local, and I've been getting them out back in 24 to 48 hours. So I'm assuming Leominster is going to be the same. Our incidence level of COVID is not super high compared to the Cape or Boston. So The best way to find that out is to go to CVS website, which typically has a time frame listed on the site that you're looking to book at.
Great, thank you. Will there be a prom? Tough to answer a question for an event 8 or 9 months away, but we are planning for a full experience. I think you could see from the tone and type of messaging that we're sending that we are, having a normal experience and are trying not to manage those aspects of the student experience that we didn't prior to COVID, such as, going home on weekends, things like that. So I would say at this time, we are planning to offer all of those same traditional type events that we do during each school year, but have to continue monitoring that and revisiting it over time to see what we can do, how we can do it. Question about, will students be allowed to use cash, or they are encouraged to stick to Penguin Points cards? So they are allowed to use cash. Penguin Points can only be used on campus. Unfortunately, Ashburnham or other businesses do not accept the Penguin Point. Can I pick up registration packet while my son is in hockey practice, or do I have to wait for my check-in time? You do have to wait for your check-in time. So please follow that time that you registered for, and we will help you out then. Elise, question about PCR. For the PCR test for the unvaccinated, can we get our own tests every week to show the school from CVS, Walgreens, et cetera?
I think it's going to depend on the turnaround testing situation. We have a great partnership with the Broad, which is out of the Cambridge Institute in Boston, that provides our tests within 48 hours. I think I'm going to have to hold to answer that question just to kind of see what turnaround times look like in the future.
Yeah, I agree. We really do have a quick, rapid turnaround time and want to maintain that, particularly among higher risk populations. So we can talk with this individual separately and come up with an answer there. Does that sound fair?
I think that sounds great. Yeah.
What time is the parent meeting on the 1st? So schedule hasn't been completely finalized yet, but we will have that out as soon as possible. Typically it's early afternoon as in previous years. If you'd like, we can chat offline and I can try to get you that information as soon as possible. Will all items that were ordered and sent to campus be in each student room prior to arrival? So we really try to do that. As you can imagine, the volume is quite high, especially with a full campus, but we do strive to get that to each individual student as soon as possible. And oftentimes it is in the room. Starting to have a few. I'm going to skip just in the interest of time. We try to keep these an hour. We have 2 minutes left. I would say school supplies, academic office can answer that question. Raj Bala, Jennifer Willis, Dave Stone, you can contact them about supplies, things like that. Transportation, the student affairs office, but we have put out several pieces of information about transportation to the school. Day students, during preseason, we did put out information about those individuals being able to stay on campus. So if you have questions, see your individual coach, but that has been shared. Sorry, go ahead, Elise.
I was going to say, Dr. Burning, could I address the question regarding the third dose, the booster shot?
Please do.
All right, so I just received the guidance that everyone else did about a third booster shot. I'm working closely with the state to see when that will be provided. Right now, it looks like they plan to start rolling that out in the winter, and they mentioned healthcare employees and high-risk individuals first. So I'm waiting for a little bit of further guidance, but once one becomes available, I will most certainly be doing our due diligence to provide that to our students here on campus.
Thank you. Schedule for the registration page should be there soon. We try to get that out before tonight, so just have a bit of patience and you should see that in the next couple of days. Sorry about that. Elise, so we really want to stick to those arrival times, right? A couple questions like we're driving up on this day, can we test on that day? It's really important that we stick to those for a number of reasons, correct?
Correct. Mainly for data points, we're looking at transmission trends. So the way that we have our testing scheduled out is going to give us the best understanding of if we do have a positive COVID.
Unvaccinated parents be allowed on campus with a mask and proof of PCR for games. We'll put that decision out next week. We really want to hear from the rest of our opponents and NEPSAC about that. So, that's where we're leaning with visitors, but do want to have additional information before we talk about fans of athletic competitions. And I don't see any others. So if you have additional questions, feel free to email me. I know at least you have probably a pretty steady inbox this time of year with parent questions. And so I know everyone has been asking Elise. You could certainly contact Josh Doyon, Director of Student Affairs, Raj Bala, Director of Academic Affairs, and Dr. Willis and Dave Stone in that office as well. Christine Moynihan in the Student Affairs office, as well as Jennifer Viana in athletics, Catherine Pollock in admissions. So many of you are familiar with our team, all are ready and are continuing to answer questions. So I really thank everyone for their questions tonight, for their involvement and engagement, and please don't hesitate to reach out. At least anything to add at the end?
No, thank you.
Great. Thanks, everyone. We'll see everyone next week. Thank you for your time and look forward to a great year. Take care.